Hi, my name is Jenova and I'm an earlobe reconstruction specialist. If you're watching this video, that's probably why you're here. Hopefully by now you've already read all the information that's on the website, but we're just going to go through it together just now in just a little bit more detail. So first of all, let's start off with the Anaesthetic Cream. I get loads of messages all about this. Does it actually work? Well, yes it does. If it didn't, you'd know about it by now, right? So all the reviews that are on Facebook and Google, etc, etc, if this cream didn't work, somebody would have told you all about it by now, so it's fine. It's lidocaine, so the exact same ingredient that's in most injectable anesthetics. So if you've ever had a dental blocker or anything like that, it's lidocaine, it's the same thing, it does the same job. The difference with this is it's in cream format, it's a topical anesthetic. So the reason it takes 2 hours to activate is because it's got to soak all the way into your skin, right? We're not injecting it directly in there, it's going to take time to soak in. Around about 2 hours is the sweet spot for that, but it normally lasts for about 6 hours once it's actually numb, so you don't need to worry about that too much either. So as long as you can follow the instructions, it'll work exactly the same as an injectable. We're going to go through that quickly now. The cream you can actually buy through a link on my website. It's a link to a licensed online pharmacy. They sell nice big tubes of 30 grams so that you don't have to worry about getting through lots and lots of little tubes. If you're going to buy it from your local pharmacy, it will be a very small 5 ml tube. You need 10 ml or 10 gram, same thing, for each ear. So that's 2 tubes for each ear if you're buying it from your local pharmacy. If not, just grab one of the big tubes that's linked on my website. So how do we apply that? Easy peasy. First of all, you're going to tie all your hair out of the way, okay, get it all out of the way. Grips, clips, slides as much as you need to get all that out of the way, especially the little baby hairs around the back, okay? You're going to wash your ears with some antibacterial soap, any antibacterial soap, you don't have to be particular about it. Quick wash, pat dry, then get the cream all over your earlobe. Just go crazy with it, go ham, just get it all over there. Then a nice square of cling film. I know cling film's a pain in the ass at the best of times, right? But just try nice square of cling film and just wrap that front and back around that earlobe. It's as simple as that. Once you've seen that soak into your skin, you're going to have to reapply that normally twice before you get to the clinic, and then one more top up if we need it when you arrive. So don't worry about reapplying the cling itself. So when you're topping up, just peel the cling down, squirt a bit more cream in, put the cling back on again. Easy peasy. If you're struggling with that or feel like you're not confident in doing that, just get someone to help you out. Easy peasy. It shouldn't cause you too much hassle. Alright, so preparation. Let's talk a little bit about that. So you want to leave your jewelry out for a minimum of 6 weeks, okay? And that only really applies if your holes are 6 millimeters or larger. If you're having this done for slits or rips or reduction, then you don't need to worry about this. If your holes are bigger than 30, you need to leave your jewelry out for a minimum of 10 weeks. And again, this is just a minimum recommendation. The longer you can leave your jewelry out, the better your results are going to be. I'm not going to go into that too much right now because I wrote a massive blog post on exactly the reasons for that. There'll be a link in the description, so go ahead and read that if that applies to you. Alright, so no alcohol, no garlic, no blood thinning medication for 7 days before the procedure. Yes, garlic is a blood thinner as well, it's a pretty powerful anticoagulant. Pretty straightforward. Make sure you contact your GP before stopping any prescribed medication. So if you're anything like, if you're on warfarin or warfarin, you definitely can't have this done while you're on that, so please go and talk to your GP about that first. You'll definitely need to eat before your appointment, so that will help prevent anything like dizziness or lightheadedness or anything like that. It's just a precaution, but it is definitely advised. If you've ever had tattoos and piercings and other things and you felt a bit lightheaded through that, it's probably because you didn't eat. So either eat before you start your journey, or if you fancy getting here a couple of hours earlier, you can come and eat something in the village nearby. There is free parking all over the place around here. On the streets, free parking. We've got car park over the road that's free as well. A few nice places to eat around here. We've got the Stamford Arms just over the road and to the left. No drinking, but the food in there is really nice. There's a co-op over the road if you fancy like a meal deal or whatever. Next to that is a really good chippy, and then I think we have a Chinese next to the pub as well, somewhere down there. Anyway, there's loads of places to eat around here. If you've travelled quite a way, I do recommend taking something back with you in the car as you go as well. So like just pick up some snacks from the co-op or something like that. It'll really help you out. We've got 2 cash points around here as well. We have one in the post office next door. Again, also one over the road in the co-op. It is right at the back inside the co-op as well, you know, just so you probably buy something on the way out, that kind of thing. A few other tips. So it is a good idea to wear old clothing. It is just a precaution. This procedure actually doesn't really bleed that much. I'm talking like a couple of drops at most, but just to be on the safe side, try not to turn up in a nice new shiny white t-shirt, okay? Not a good idea. If you've got particularly damaged earlobes, if they're particularly scarred, so it's normally from excessive stretching, if you've had blowouts, that kind of damage, it's a really good idea to use some bio oil before your appointment as well. So I'm talking about however many weeks or months in advance you've booked. Just use it once a day, best at night, all the way leading up to your appointment, right? So it just helps reduce that scarring as much as possible so we can get the best possible result from this. So you'll only need to apply that bio oil right at the top here. So at the top of your earlobe here. So anything else, you've got any excess that's coming down here, we don't really need to worry too much about the condition that that's in, because that's not staying with you. So it is just a little bit, just a 1-2 drop just at the front, just at the top here. That'd be, yeah, super helpful to get a really nice result from this. If you're using public transport, please be cautious of the timings around your appointment. Please allow a good hour either side of that if you're using trains and buses, etc. Just out of respect for other customers and other clients that are going to be in here. If you're late, then the next person is late, and the next person is late, and the next person is late. So just have a little bit of respect for that. The train station is the complete opposite side of Leicester to where we are here. You will need to allow quite a bit of time for that if you're doing that. Honestly, I just recommend finding a helpful friend or good family member just to drive you up here. It'll be much less stressful, much less hassle just to come up the M1. We are 2 minutes off junction 21A off the M1, so super easy no matter whether you're traveling from north or south. Really easy to get to us that way. And like I said, there's free parking all over the place around here all day, so you don't have to worry about that either. I think that's, travel-wise, that's probably your best option. It's also just really great having someone here with you just for moral support in general. Once we get started, it's only about 10 minutes per ear, so it's pretty quick, and they're not going to get bored. If they don't want to be exactly in the room with you, they can just sit out in the waiting area. We've got a TV out there, you know, it's fine. It is good having someone with you if you can bring someone with you. Cool, let's go through the aftercare. So this bit is super important because this is how you're going to minimize your risk of infection, okay? So infection is always a possibility on any area of broken skin. Doesn't matter if you're dealing with a cat scratch or spinal surgery, right? Any area of broken skin is open to infection because that's how bacteria is going to get in, okay? So we're going to talk about your ways of minimizing your infection risk. So the first one is just to use salt water twice a day directly on the area. It's going to kill any bacteria, okay? So quickest way to do this, just get a mug or a glass, half filled with boiling water, nice big pinch of salt in there, and I do mean just big pinch. So don't be going shoveling that in with your teaspoon. It is just big pinch. Too much salt in your salt water is actually going to really dry your skin out, and because you're doing this twice a day for about 10-12-ish days, your skin's going to start to get really dry, really flaky if you're using too much salt here. So it is just a big pinch. Stir that up, let it cool down, and then something disposable. So ideally kitchen roll is perfect for this. Try and avoid cotton wool. You don't want fibers coming into contact with the area, they're going to get stuck. Okay, so kitchen roll, clean piece for each ear, so a different piece for each ear, I mean. So dunk that into your salt water, pat that front and back, both sides, and chuck it all in the bin. Okay, do not be tempted to make up a bottle of salt water solution or anything like that to use later in the day or later in the week. Just don't do it. It takes 2 minutes to make this salt water solution. Make it fresh every time you use it. Super easy. Alright, next most important thing is to change your pillowcases every night for at least your first 3 nights. There is not much that your earlobes are going to come into contact with, right, on a day-to-day basis. The biggest thing your earlobes touch are your pillowcases. So we're going to change those nice and clean, fresh every night for a minimum of 3 nights. You might get a little bit of bleeding overnight on your first night, and I mean a couple of spots at most, right? And it's pretty uncommon. But just to be on the safe side, if you want to protect your bedding, just get an old towel down there, as long as it's clean. And again, if you're using an old towel and you want to do that a couple of nights, make sure it's clean every night. Easy peasy. So same applies to any clothing that might come into contact with the area. So if you've got like high collars on your coats, if you're going to wear hats and scarves, anything, basically anything that's going to come anywhere near here must be clean, okay? Clean, fresh for minimum 3 days, but try and do it for the 10, right? So just everything through the wash, your hats through the wash, scarves through the wash, hoodies through the wash. Just make sure everything is clean that's going to touch this area. So for example, if you wear headphones, even if they're in-ear headphones, you're going to wipe all of that over, right? So just think about which part of that is going to come into contact with this area. So if you've got over-ear headphones, give all of that inside area a good wipe over. You can use your salt water for this, or if you want some alcohol tips from us, just ask me when you're here. Wipe all that over before you next use them, and try and do that every time you use them for the next 3 days. Same for your in-ear headphones, okay, your earbuds. Just think about, again, where that's going to come into contact. So it's not just the earbud itself, a little bit of that wire, it's going to hang right here, okay? So the wire from your earbuds is right here. So just wipe all that over. It'll take you 2 minutes. Really, really quick and easy. Showering as normal is absolutely fine. However, try and minimize the amount of time the water is directly on your ears, okay? So try and just keep that out the flow of the shower. For the first few days, just prioritize drying your ears first, okay? So when you get out the shower, and maybe to have a bit of kitchen roll handy, you're going to pat your ears dry first and then bin that, and then carry on with everything else. Avoid swimming or submerging your ears for 10 days. So that doesn't really mean bathing particularly. You can have a bath, that's fine, because how often in the bath are your ears actually in the water? Probably not. So bathing is actually fine. Just swimming is a big one, no submerging, and just be conscious if you are in the bath, do not get your earlobes in the water in the bath. Try and take a couple of days off your gym routine, please. Specifically avoiding any cardio exercise or any excessive physical activity for about 24 hours, right? You can sometimes trigger a little bit of bleeding if you've elevated your heart rate, right? It's just 24 hours, just don't do it. You want to do some weights or some yoga or something, great, just don't do any cardio. You won't need to cover the area with any dressings or bandages or plasters or anything like that unless you are in a particularly dusty or dirty environment. So for example, if you work in a warehouse or a factory, or if you're a gardener or a builder or anything like that, then yes, for the first few days you want to protect it a little bit, but you don't want anything sticky directly on the area. So best advice for this is to just very loosely tape some kitchen roll to the area, very, very loose, kind of micropore it much higher up. Don't get the micropore or anything sticky directly on the area. But that's not going to apply to too many of you. You do need to keep all your hair out of the way, especially at night. This is really important. I get a lot of clients telling me that they're just going to like disguise their stitches for a few days by wearing their hair down, and I'm like, no, you're really not. You'd be amazed the amount of bacteria that's in the air. It's going to get all picked up by your hair, and your hair is rubbing back and forth across your ears. It's just not a good idea at all. You're increasing your risk of infection by doing that. Please don't. You want to keep all that hair out the way, definitely at night. Super important. Sunbeds and sunbathing. Absolute no-no, I'm afraid, for the first month. Please just don't do it. If you are going to do it, and I know some of you are going to do it anyway, you're going to use some factor 50 sunblock on your ears if you do, but I'm asking you not to. It's mostly because you're going to risk making your scarring significantly worse from the UV damage, so factor 50 if you really must, but please just try not to. I'm sure you can live without that sunbed for a month. So let's talk about the stitches, okay? Some of you might have had stitches before. If you haven't, nothing to be worried about. They're not going to hurt, so you're going to have them out in about 10 days as well, because we're using non-dissolvables. You're not going to feel them when they come out either, easy peasy. You can take them out yourself. A lot of my clients have removed their stitches themselves. I've got a family member to help them take them out, that's fine. If that bothers you or you're uncomfortable with that, please just go to a walk-in centre. They'll take those stitches out in 5 minutes, easy peasy. You can also book in for that in advance with your GP. You just book in with a nurse. 10 days is great for this. I like 10 days. It's a nice round number. It's probably, if anything, a little on the excessive side. You could probably take them out as early as day 5 and be absolutely fine. But because we're doing this for cosmetic reasons and we're trying to get a really specific shape and a really nice, neat heel, we just want to give that a little bit of extra time to settle down. So I like 10 days before you take those out. That said, if you've got something coming up, if you've got a job interview you're trying to get to or something like that, honestly, you can take them out anytime after day 5 and still be absolutely fine, so don't worry about that. Always try and use your salt water for an extra 2 days after you've had your stitches out. Reason being is you're going to have some tiny little holes there where the stitches have pulled through, a little bit of broken skin there as you can expect, so a little bit of salt water again, 2 days, easy peasy. You might lose a few of those stitches during the healing process itself, you know, while you're cleaning it, or maybe you sleep on that side and some's come out in your sleep, etc. That's fine, it's absolutely fine. Again, because we're doing this procedure for cosmetic reasons, we put an abundance of stitches in your ear. We're going to put an extra load in because we're trying to get a really specific shape. If you had a similar injury or wound area and you went to A&E for stitches for a similar thing, they'd probably whack 3 stitches in you and send you home. We use on average about 8 to 10 stitches per ear. It depends on the ear, but it's somewhere around that. So that's a lot more stitches than you actually need. So if you find even maybe 3 or 4 have come out in one ear, that's fine. That's fine. It's not, your ear's not going to suddenly pop open or anything like that. You could lose loads of them and you'd still be absolutely fine. So don't worry about that. Even after your stitches have come out at day 10, there's still going to be quite a lot of swelling on the area. Now the swelling is the longest part of this healing procedure, so it's going to take a good 3 weeks for that swelling to fully come down. You'll find that it's unlikely both sides are going to swell up identically. Okay, so you're probably going to have one side that's going to look bigger than the other. This will actually also go back and forth. It depends on how you sleep as well. You'll also notice sometimes the swelling can bulge a little bit through your stitches and look a bit odd. This is all perfectly normal. It's all part of the healing procedure. It'll take about 3 weeks for that to fully come down. So just have a little bit of patience before being too judgmental with the shape while it's healing. It is going to look a bit big and bulgy and misshapen. It's because it's swollen, and the swelling will continue even after you've had your stitches out, so about 3 weeks before that swelling comes down. In terms of expected scarring levels, most of this is down to your genetics, okay? So if you have a look at any of your other scars, that's usually a good indication of what your scarring from this is going to look like. So for example, my scars always come up like a kind of, I don't know if you can see that there, they come up kind of whitish, right? They're quite pale. So I know if I had this done, my scar lines would be quite pale and whitish. If you have a look at all the photos in my portfolio on the website, you'll notice a huge array of colours and thicknesses and types of scarring, and it's all down to your genetics. Odds are it's going to look a similar colour to any of your other kind of scratches and scars and things that you've had before. Okay, so once your stitches are out, you can start using bio oil, which is great. There's loads of alternatives to this as well. There's plenty of other scarring reduction products that are out there. Feel free to do your own research and use whatever the hell you like. Bio oil is just something that I've used on myself and I find it quite effective. You want to use it just once a day really, and that's kind of best at night. So try and get into the habit of using that. Maybe put it on your bedside table. Just like 1 drop each side. It's just like a tiny little bit. I would go for about a month using this. There's no real definitive time frame of how long you should use this for. If you asked bio oil how long to use it for, they'd probably say use it forever, but then they want to sell you more product, so I think a month is good enough to get a really good result from this. If you want to use it longer than that, go ahead, feel free. That's totally up to you at that point, but a month is what I would aim for. Yeah, that'd be my recommendation. It's not uncommon to get some bruising show up around the area too, so you can sometimes get some come up around your neck and your jawline as well. It might come up just a little bit yellowish around here. Again, all part of the healing process. It's all normal. Most of your bruising will go down by about 10 days as well. And some people don't get any bruising, so don't worry if you don't have any bruising, you're just lucky. In terms of pain relief, the most pain relief you'll need is some paracetamol. It's really not as bad as you think it's going to be. Even then, if you want to bring some paracetamol with you, it is just as a precaution, mostly for the journey home, right? So the procedure itself, you're not going to feel anything. Afterwards, you will start to get a bit of a like a warm aching sensation, like, so you know when if you've had your ears pierced before, right? It's exactly like that. So once you've had it pierced, you get that kind of warming, aching sensation as it's swelling, and it kind of, I don't really want to use the word burns, but it does burn a little bit, and if you've had piercings, you'll know that's exactly the right word for it. That's what you're going to feel, right? You're going to feel exactly that for about 3-4 hours afterwards while that's settling down. If you want to take some paracetamol for that, that's absolutely fine. Don't be a hero about it. If it's hurting you, just take some paracetamol, that's fine. I will stress that most people don't take anything at all for this. It's really not, unless you've taken paracetamol for piercings in the past. If you're uncomfortable with that level of sensation, then you won't need anything for this, for sure. I do ask that you absolutely avoid ibuprofen for at least 3 days. Reason being is we actually want this to stay swollen. The swelling in this area, it's not going to be much. You're going to notice it more than anyone else looking at you. But we actually want it to stay swollen because all of that is pushing together, and while it's pushing together, it's going to create a really minimal scar line, which is what we're going for here. We want as little scarring as possible, and while it's all swelling, it's pushing together, and that's kind of what we want it to stay like for as long as we can. Also, try not to take any aspirin. Not many people take aspirin as a painkiller anymore, but it is a blood thinner, so avoid that for 24 hours as well. Largely just stick to paracetamol and you'll be absolutely fine. If you're wondering how are you going to remember all of this information, and it is a lot of information, I've made aftercare sheets exactly for this. So there's a preparation sheet, there's an aftercare sheet, both of those on the website. Please go and just take a little screenshot of that so you know you've got it with you. If you've got any questions and you think it'll be helpful for other people as well, feel free to put those questions in the comments below. I will answer all of them as long as they're relevant. If you've got any private questions for me, great. You can email me, text me, or WhatsApp me. It's probably the fastest way to get a response. I get a lot of people ringing me, and I've got a lot of voicemails. I think currently my voicemail inbox is full. So please, I wouldn't even try. The odds of me having any time to answer phone calls during the day is slim. I do about 10 reconstructions a day. I get about 5 minutes in between each one. I will have more time to reply to a text message than I will to answer a phone call. So yeah, anything urgent, honestly, just email me, text me, WhatsApp me, easy peasy. All the information links for everything that we've spoken about today will be in the description below. Please like and subscribe. I've got so much happening on this channel like you wouldn't believe. Like, there's loads of cool stuff coming up as well. You don't want to miss it. The future is happening. It's happening on my channel. Check it out. Thank you guys so much for sticking with this video all the way to the end. You guys are amazing, and I hope we get to see you soon. Thank you so much.